This is a continuation of your discussion on anatomy and physiology of your neurosystem. So we've talked about your cerebrum on the previous recorded lecture. So I hope that you'll recall the specific functions of your frontal, temporal, parietal, and occipital lobe. Then we'll proceed to your diencephalon. Class, your diencephalon is also known as your interbrain. Your diencephalon is composed of your thalamus, epithalamus, and your hypothalamus. So class, your thalamus would lie on either side of the third ventricle. I'll show you the picture of a ventricle later on. It would relay the station. It is considered to be a relay station for all sensations except smell. Meaning class, the sensation impulses would pass through your thalamus first before it proceeds to other lobes of the brain, except for your sense of smell. Furthermore, it is also where the memory, sensation, and pain impulses pass through. So meaning class, your memory, sensation, and pain impulses would be affected if ever there is a damage on the thalamus. Now, class, these are the ventricles that was mentioned. So it was mentioned to you that the location of your thalamus is between the third ventricles. So class, when I say ventricles, it is not only your heart that would contain the ventricles. Class, the ventricles of the brain would act as network of cavities that would be filled with your cerebrospinal fluid. So recall that your brain is being supplied with cerebrospinal fluid, and the purpose of the cerebrospinal fluid is to provide nutrients to your brain in the form of glucose. Now class, there are two lateral ventricles. Okay, there is what you refer to as the third ventricle, and then you have the cerebral aqueduct, and then you also have your fourth ventricle. Okay, then class, the central canal is the canal that would lead going towards your spinal cord. Okay, so try to remember these ventricles. Now, you have your hypothalamus. Class, your hypothalamus is located anterior and inferior to the thalamus and beneath and lateral to the third ventricle. Okay, so its main function is related to endocrine system, as it would regulate the pituitary secretion of several hormones. Now class, with that, it would influence metabolism, reproduction, even your stress response because of the regulation of your adenocorticotropic releasing hormone, and then also your urine production related to the production of your vasopressin, your antidiuretic hormone. Okay, your vasopressin and your antidiuretic hormone, or even your aldosterone. Okay, so that's how your hypothalamus would regulate your endocrine system. Next, so class, other than that, your hypothalamus would also take care of fluid balance. So fluid balance is related again to vasopressin mentioned, or your antidiuretic hormone. Then it would also maintain your temperature regulation. Class, the maintenance of temperature regulation is usually accomplished through the vasoconstriction and vasodilatory mechanisms. Then, your hypothalamus also acts as the hunger center and your appetite control. So recall our discussion in gastrointestinal system that your hypothalamus is the center of satiety, meaning it would be the center of satisfaction when it comes to your food. Then it also regulates your sleep-wake cycle, also your blood pressure, also your aggressive sexual behavior and emotional response. That's why the expression, "I love you with all my hypothalamus." Then class, it is also your autonomic nervous system regulation. By the way, among the emotional responses here, that would include your blushing, that would include your rage, depression, then you have your panic and fear. Next, so class, you have your brainstem. The brainstem is composed of your midbrain, your pons, and your medulla oblongata. So let's talk about their function. Class, your midbrain would be the one to connect the pons and the cerebellum with the cerebral hemispheres. So that's the purpose of your midbrain. It acts as sensory and motor pathways. What do I mean by sensory and motor pathways? Meaning class, the interpretation of signal, okay, from the afferent neurons would pass through first your midbrain before it can proceed to your cerebrum. Okay, that is where your sensory and motor pathways are. It is also considered to be the center of your auditory and visual reflexes. That's why class, if I want to evaluate the functioning of the brainstem, one way for me to evaluate it is by testing the auditory and then the visual reflexes of my patient. For example, we'd have the oculogyric crisis, okay, or the checking for the doll's eye, which would check for the reflexes of the eye. I would also do caloric testing, which would evaluate for the reflexes of the ears. Okay, so class, this would evaluate the functioning of your midbrain. A patient class with damaged brainstem has a poor prognosis compared to those patients who have a well-functioning brainstem. Okay, so that's why class we are checking for these reflexes, because if these reflexes are not anymore intact, that would mean damage to the midbrain, which is a part of your brainstem, leading towards a poor prognosis on the part of our patient. Then we have your pons. Class, your pons is the bridge between the two halves of your cerebellum. It is also the bridge between your medulla and your midbrain. It also contains the motor and sensory pathways, and more importantly, class, it helps regulate your respiration. So part of your pons regulate your respiration. Then you also have your medulla oblongata. Class, your medulla oblongata contains the motor and sensory fibers. Okay, it contains the motor fiber from the brain to the spinal cord, and then the sensory fiber, which would be from your spinal cord going towards your brain. Okay, the same concept as your afferent and efferent. Class, reflex center. It is considered, your medulla oblongata is considered to be the reflex center for respiration, blood pressure control, heart rate, coughing, which is also a protective mechanism, vomiting, swallowing, and sneezing. Meaning, a problem on my medulla oblongata would possibly lead to problems on breathing and circulation, vital functions of our life. Now, in a condition class referred to as brainstem herniation, that's why we always watch out for brainstem herniation, because once class your medulla oblongata would herniate through the foramen magnum, it would cause life-threatening consequences. Okay, class, recall the foramen magnum, that's the big hole here, okay, in which your spinal cord inserts going towards your brain. Now class, if there is brain herniation, meaning a part of the brain moves downward, we don't want that to happen because that would compress your medulla oblongata. A compression on your medulla oblongata again would lead to your respiratory and cardiac depression. Okay, so we refer to that condition as your brainstem herniation, which is also a complication of your increased intracranial pressure. Next, let's talk about your cerebellum. So class, your cerebellum would integrate sensory information to provide smooth coordinated movement. Okay, it would provide smooth coordinated movement. So class, if you would look at the location of your cerebellum, it is said to be posterior to the midbrain and the pons. So class, this is your midbrain and pons. Okay, your cerebellum is here. And it is found below, okay, below or inferior to your occipital lobe. Your occipital lobe is somewhere here. Now, class, your cerebellum is also in charge of your fine movement, balance, and position, and also proprioception. So class, proprioception is the awareness of the position of the extremities without looking at them. Okay, so class, your proprioception is also referred to as your postural sense, meaning it is the ability of the patient to recognize whether he is standing, whether he is lying down, whether he is in supine position, whether his hands are elevated or not, or his feet is on the floor or not. Okay, without looking at those. Those are referred to as proprioception. And that is taken care of by your cerebellum. Okay, taken care of by your cerebellum. So class, when I say cerebellum, your cerebellum is usually associated with balance and coordination. Then you have the protective structures. Now class, for the protective structures, earlier we mentioned that brain is a delicate organ. Being delicate is protected by your skull. Now class, your skull would be composed of 8 bones. Okay, so you have your frontal bone, you have your sphenoidal bone or your sphenoid. Then class, you also have your ethmoid bone. You also have your parietal bones. There are 2 parietal bones. You have your temporal bones. Of course, there are 2 temporal bones, and your occipital bone. All in all, class, that is the main covering of your brain. Okay, that is composed of 8 bones. Now, you also have the term meninges. I don't know if you've heard of meninges, but it's the one that is inflamed in meningitis. So, class, your meninges would provide protection, support, and nourishment to your brain. Again, protection, support, and nourishment to the brain. Now, class, your meninges has 3 layers. The 3 layers class of meninges is seen as dura mater, arachnoid matter, and pia mater. So class, if this is your brain, this is the cerebral tissue, the first layer of your meninges that would be found is your pia mater. That is followed by your arachnoid matter and followed by your dura mater. That's why I usually memorize this as PAD. Okay, I usually say that my brain is padded. Okay, it's padded by meninges. So the first layer is pia matter, then you have your arachnoid matter, then you have your dura matter. Note that your dura matter is divided into two parts. You have your periosteal dura matter, and then you also have your meningeal dura matter. Let's talk about your dura mater. So class, your dura mater is considered to be the outermost layer of your meninges. It is tough, thick, inelastic fibrous, and gray, and covers the brain and the spinal cord. So class, if you would notice, your meninges will be continuous from your brain going towards your spinal cord. Now, in incidents wherein there is increase in your ICP, the brain tissue would be compressed against the dural fold, or they will be displaced around it. Okay, you refer to that one as your herniation. Meaning class, part of the brain tissue may go out of the dura fold in such a way that it is herniating through the dura folds. Okay, so class, that's your dura mater. So class, you have your periosteal and then your meningeal dura mater. Periosteal in such a way that it's near your skull, which is your bone, periosteum. In class, you have your meningeal because it's already the meninges part of your dura mater. Now class, there are several dural folds, and these dural folds are referred to as your falx. So class, these are folds of the meningeal dura. Your meningeal dura would detach from the periosteal dura, and then both of the parts of the detached meningeal dura would fold and fuse with each other to form what we call your falx. So you have class your several falxes. So there are four actually. So you have your falx cerebri, you have your falx cerebelli, you also have your tentorium cerebelli, and then you have your diaphragma cellae. So class, these four falxes or four dural notches or dural folds are where possibly your brain might herniate. So class, the purpose actually of this dural fold is to allow for venous drainage of your brain. Okay, so the purpose of your dural fold is to allow for the venous drainage of your brain. Now, you have your arachnoid layer. So after the dura mater, you have your arachnoid layer. So class, your arachnoid is considered to be extremely delicate. Okay, it's thin and delicate. And then it's like your spider web. Your arachnoid class would contain the arachnoid villi, which would absorb the CSF into the venous system. Class, under your arachnoid, you have what you refer to as your subarachnoid space. So as the term implies, subarachnoid, subclass, meaning under the arachnoid. So class, your subarachnoid space is where the absorption of your villi would take place. Then you have your pia mater. Your pia mater class is considered to be a thin, transparent layer. Okay, it's a thin, transparent layer between the cranial tissue or the brain tissue and then parts of your meninges. Now, there are several spaces that could possibly occur in the meninges. One is your subarachnoid space, as I previously mentioned. So class, your subarachnoid space is below your arachnoid. That's why it's defined as a space between your pia mater and then your arachnoid. Now, there are two other spaces. The two other spaces are referred to as your subdural space and then your epidural space. So class, when I say subdural space, that's of course below your dura, and that would be between your dura and your arachnoid. Then class, your epidural space, epidural, okay class, that means above. Okay, that would mean above your dural space. So class, that is between your periosteal dura and your bone. Okay, so that is class already between your periosteal dura and your skull. Now, the two spaces that I have mentioned, your subdural space and your epidural space, are considered to be potential spaces. When I say class potential, meaning it is not normally existent, but it could possibly, exist whenever there is abnormal deposition of fluid, whenever there is abnormal deposition of hemorrhage or blood for that matter. Okay, that's why class, you have what we refer to as your subdural hemorrhage. We also have what you refer to as your epidural hemorrhage. Now, so class, you have here your subdural hematoma and then your epidural hematoma, just for you to see what's the difference between the two. Class, you have here the CT scan images, but please take note that your CT scan would not produce the pink area there. Okay, it would appear to be shades of gray and white. Now class, if you would look at the subdural hematoma, meaning there is hematoma or formation of blood inside your subdural space. Look at the shape class. It appears to be concave, crescent shape, and there will be bridging veins, and then this is usually occurs among your elderly and alcoholics. Okay? Now, whereas class, your epidural hematoma would appear to be convex, okay, it's lens shape, And then this usually involves your middle meningeal artery. Usually the patient would be described as somebody with lucid interval, okay, because of its involvement on the epidural space. Okay. Now, class, if you would look at the comparison, on the left, class, is your epidural hemorrhage or hematoma. On the right, class, is your subdural hematoma. So that's why, class, among your patients with neurologic problem, your CT scan is among the immediate diagnostic tests being done, because we would want to know or differentiate the problem experienced by the patient. Then you have your cerebrospinal fluid. So class, as mentioned, your cerebrospinal fluid would be the fluid that would provide nutrients to your brain. Okay, it carries your carbohydrates. Class, your cerebrospinal fluid is clear and colorless normally, as shown on the slide. And then class, it is produced by the choroid plexus of your ventricular system. Class, the four ventricles that I have shown you earlier is also referred to as your ventricular system. Okay, it circulates around the brain and the spinal cord, and then the amount of which is playing at 80 ml to 200 ml on the average, that is 150 ml. Class, your cerebrospinal fluid could be tested to verify for the presence of infection. The test, class, or the cerebrospinal fluid is extracted on the procedure that we refer to as your lumbar puncture or your lumbar tap. Okay, so class, your lumbar puncture or your lumbar tap should be done in a sterile way, in such a way that infection will not be going inside the spinal cord and then your meninges going towards your brain. Because class, normally your spinal cord, or no, your cerebrospinal fluid is considered to be a sterile substance. Okay, it's considered to be a sterile substance. Hence, the procedure should also be done in a sterile environment. Okay, class, if you have noticed, there are four tubes there, because usually if you're doing your CSF testing, okay, class, there are four bottles that would be collected. And then these bottles should be numbered consecutively, class, from the first bottle, which collected the specimen, up to the fourth. Okay, so the number should be consecutive on the way the specimen was extracted. Then, we have again, class, this is your ventricles. So, class, this is how your CSF would be flowing towards your brain. So the CSF would be first on the lateral ventricles of the cerebral hemisphere, and then that would proceed to the third ventricle of the diencephalon through your midbrain. And then it would go towards your fourth ventricle before it would go towards your subarachnoid space, where it will be reabsorbed through your arachnoid villi. And then other than that, class, part of which from the fourth ventricle will go towards the central canal going towards your spinal cord. Because again, your CSF would supply nutrients, or it circulates between your brain and your spinal cord. So again, class, for the CSF circulation, okay, that would be from the lateral ventricle going towards the third ventricle, going towards the fourth ventricle. From the fourth ventricle, class, it would go to your subarachnoid space, or it would go to your central canal. If it's going to the subarachnoid space, it will be reabsorbed in the venous system through the arachnoid villi. If it is going through the central canal, it would go towards your spinal column. Now, class, cerebral circulation. When I say cerebral circulation, this talks about the blood supply of our brain. So our brain needs a lot of blood given the activity that it's doing. So class, your brain receives about 750 ml of blood per minute. And then class, this is about 15% of our cardiac output. So about 15% of the cardiac output would go to the brain to supply the blood needed by the brain. Okay? Class, it needs 20% of the total oxygen uptake of our body. So 20% of the oxygen that we breathe in would go to our brain. Okay, that is for the purpose of glucose metabolism. So it would need a lot of energy source for glucose metabolism. So class, if you would look at the image, this shows to us the common carotid artery. So class, this is your common carotid artery, which branches out to your internal carotid artery and external carotid artery. Class, your common carotid artery is able to supply 85% of the blood going towards the brain. Okay, 85% of the blood needed by the brain is supplied by your common carotid arteries. So again, that branches out to your external and internal carotid artery. For that reason, class, okay, you are educated that you are not supposed to palpate, okay, the two carotid arteries bilaterally at the same time, because that would cause occlusion of your carotid arteries that would lead to decreased blood flow going towards your brain. Okay, for that reason, we don't want your brain to be hypoxic. We do not palpate your carotid arteries at the same time. Then class, you have your major blood supplies to the brain. Okay, so class, you have your anterior and middle internal cerebral arteries. So class, this is your middle cerebral artery. Uh, Class, this would supply blood to the cerebral. Okay, this would supply blood to your cerebral hemispheres. Then you have your internal carotid artery, which I have shown you earlier, okay, to be a part of your, or to be a branch of your common carotid artery. So class, your internal carotid artery usually supplies on the anterior part of your brain. Okay, class, if you would look at the image here, your internal carotid artery is directed towards the anterior part of the brain. Then you have your vertebral arteries, class. Your vertebral arteries is on the posterior part of your brain. And then you also have your basilar artery. Your basilar artery would be supplying blood to the brainstem and then the cerebellum. Then class, you have the term that you refer to as the circle of Willis. So class, this is your circle of Willis. Okay? Class, your circle of Willis is a circle of connected blood vessels that would provide alternative route in case there is something that blocks one route. Okay, again, the purpose of your circle of Willis is to provide alternative routes. Now, class, this is your circle of Willis. As you can notice, class, there are a lot of blood vessels and that could offer alternative route. In such a way, class, if there is, for example, a block here, okay, the blood flow could still go here and it could supply blood on other parts of the brain. So, class, it is a collateral blood flow between the anterior and posterior parts of the brain, which is to protect our brain against ischemia. It provides alternative routes. It provides collateral blood flow to other parts of the brain. Then class, because of the structure of your circle of Willis, class, your circle of Willis is a particular site of aneurysm also. Okay, so class, saccular or berry type aneurysms are common in your circle of Willis. So class, remember that when I say aneurysm, this is usually caused by the weakening of your arterial walls, and then later on leads towards outpouching in the arterial walls. So class, as you can see, there is anterior communicating artery aneurysm among 40% of cases. Then you have your middle cerebral artery aneurysm, okay, around 34% of cases, and then basilar tip aneurysm at around 8% of cases. So class, meaning, if you would look at these statistics, the most common type of aneurysm will be your anterior communicating artery aneurysm. Okay, so class, what's the danger in this aneurysm? Class, the aneurysm may possibly rupture, leading towards brain hemorrhage. Okay, cerebral hemorrhage, we call it. So class, again, because of the structure of the circle of Willis, it is at higher risk of having your aneurysm. Then you have your spinal cord. Class, your spinal cord is the link actually between your brain and the peripheral nervous system. It would integrate incoming information response through a reflex mechanism. Approximately, it is about 45 centimeters long. Okay, that's 18 inches. Now, its thickness is about the thickness of a finger. And then, class, it would come out from the brain through the foramen magnum and it goes towards your lumbar one. Okay, it goes towards your vertebra, the first lumbar vertebra. Okay, the lower aspect of the first lumbar vertebrae. So, class, this is how your spinal cord would look like. Okay, this image would also remind us that there are 8 cervical nerves, there are 12 thoracic nerves, there are 5 lumbar nerves, and then there are 5 also sacral nerves. Now class, try to recall the number of vertebrae, okay, or the number of bones for each of the spine. We also have the term class reticular formation. So your reticular formation is located between the central core of the brainstem. So class, if this is your brainstem, okay, this is where your reticular formation is located. Class, you might have heard of the term RAS. Okay, this is not your renin-angiotensin system. But class, your RAS is your reticular activation system. Class, your RAS is a stimulating system for the cerebral cortex. So class, the RAS is in charge for arousal and maintaining the consciousness and sleep-wake transition of our patient. If our patients would have problems with the reticular stimulating system class or activating system, the patients would have problems on their sleep-wake cycle and their circadian rhythm. Plus, also in your reticular activating system, we have what you refer to as your motor nuclei. So class, nuclei, this is the group of your cell body. So class, this nuclei is in charge of your muscle tone and also coordinate your movements. So in charge of muscle tone and coordination of movements. Then class, you have your vertebral column. So class, your vertebral column surrounds and protects your spinal cord. So class, your vertebral column would include your cervical vertebrae, your thoracic vertebrae, you have your lumbar vertebrae, and then you have your sacrum. And then you have class your coccyx, okay, or your coccyx. Now, class, if you would look at it, your cerebral vertebrae is composed of 7 bones. Your thoracic vertebrae is composed of 12 bones. Your lumbar vertebrae is composed of 5. And then your sacral is a fusion of 5 bones. Now, try to recall the number of nerves that we have mentioned earlier. And try to compare the number of nerves to the number of vertebrae. Okay, is there any difference on the number of nerves and then the number of vertebrae? And what is the explanation for that? Okay. Also, class, take note that anatomically we refer to C1 as your atlas, and then your C2 is your axis. Okay, your atlas and your axis could be easily palpated during physical examination. Then, class, you have your spinal roots. So, class, your spinal roots could either be the posterior root or the anterior root. Now, class, the posterior root is the cell body of sensory neurons. Okay, so again, the posterior root is referred to as the cell body for sensory neurons. If you look at this class, no, so this is the posterior aspect of the posterior horn of your spinal root. If you would look at this, they're all talking about sensory. Now, class, your anterior root, on the other hand, are your somatic and visceral motor cells, okay, or motor neurons. So, class, if you would look at it, if there will be a damage on the posterior root, it would result to loss of sensation because these are sensory neurons. On the other hand, if there will be a damage on the anterior horn, class, okay, it would result to paralysis because these are, okay, specifically flaccid paralysis because these are motor neurons. Now, class, there are also 2 kinds of pathways. You have your ascending pathway and then your descending pathways. Class, the ascending pathway is referred to as your sensory pathways. On the other hand, your descending pathways are referred to as your motor pathways. Okay, just the same as your ascending neurons and then your afferent neurons and then efferent neurons. So, class, ascending pathways. Okay, typically here you have your dorsal column, medial lemniscus system. You also have your spinocerebellar tracts. You also have your anterolateral system. Okay, now class, there are major ascending tracts. One is your lateral and anterior spinothalamic tract. So class, your lateral and anterior spinothalamic tract will be found here. So this is your lateral and this is your anterior spinothalamic tract. Class, this is the tract wherein it helps your patient feel pain, fine touch, temperature, your proprioception or your perception of your position, and your vibratory sense. On the other hand, class, your posterior column, which includes your fasciculus gracilis and then your fasciculus cuneatus, also known as your gracile fasciculus, and then your cuneate fasciculus, they are in charge for the transmission of deep touch, position, vibration, pressure, and passive motion from the same side of the body. So class, any problem with this ascending tract would lead to a problem on sensation. Okay, meaning these parts of the body will not be able to feel any pain or any temperature or any proprioception. For example, if the damage class is on the posterior column, okay, on the dorsal column medial lemniscus system, you would expect that the patient is unable to discriminate between light touch and deep touch. And your patient will not be able to feel if there is passive range of motion activities on the same side of the body. Okay, so class, take note, when I'm dealing with the spinal cord, it's usually on the same side of the body. If the right side of the spinal cord is damaged, it is the right side of the body that will not be able to feel the sensation. Whereas class, on your brain, if it is the right side of the brain that is damaged, it will be the left side of the body that will be feeling the signs and symptoms. Because class, of the decussation or the crisscrossing of our nerves in our brain. Okay. On the succeeding lecture, class will be talking about your peripheral nervous system. Thank you very much for your attention.